Cozy Hospital Emergency Department. This is Rachel. Yes, just a second. Dr. Cozy on call on line 1. Dr. Cozy, line 1. Cozy Hospital Emergency Department. This is Rachel. How can I help you? Yeah, give me just a second here. Okay. How do you spell the patient's last name? First name? And date of birth. So it looks like we did a liver function study on December 27th. That's all you're looking for? Yes, I can send that right to you. Okay, should be on its way to you. Okay, no problem. Cozy Hospital Emergency Department. This is Rachel. No, we do not go by appointment. We are walk-in. No, I'm sorry, I can't make an exception. No, you can't reserve a room. I'm really sorry. Yeah, I can transfer you to our internal medicine department and see if they have any openings today. No, I'm sorry. I think you're gonna have to try a different hospital. We are not able to facilitate that. Okay, well, I hope you have a better day. Bye. Hi. Yeah, you look like you got it pretty good. Okay. Really quickly, can you tell me your name, first and last? Okay. And do you know what the date is today? Good. You know where you are? Okay. I do need to ask you just a couple of questions, okay? Have you lost consciousness at all? Okay. Any dizziness or ringing in your ears? Any mental confusion, slurring speech, difficulty finding words? How about any nausea or vomiting? And are you feeling sleepy? Okay. Good. Any other injuries? Okay, and any broken skin? Okay. I do need to do a quick exam with you just to help and determine the severity. For starters, can I get you to open your mouth for me? I'm going to slide this right under your tongue. Close. Okay, no, we have a different way we can do this. If you're having a hard time closing your mouth around it, it's not a problem. Okay. So this is an ear thermometer, and we are going to need to check both ears because sometimes this thing is a little funky. Okay. So this is just going to go in your ear just like so. Okay. It might take a couple seconds. Now the other ear. Okay. Temp is in normal range. I just need to slide this cuff around one of your arms, okay? And then this guy is going to clamp right on one of your index fingers, just like so. There you go. That's just going to be monitoring your blood pressure, your heart rate, and your oxygen levels, right? Okay, let's just see preliminarily. Do you know what your blood pressure is normally? Okay. It's a bit elevated, which is normal when people are in pain, especially after an accident, because your endorphins start pumping. Okay. All right. So I want you to direct your gaze right here, right in between my eyebrows, okay? Okay, I want you to keep your head really still, and I'm going to move my finger around. I want you to track my finger only using your eyes, okay? So don't turn your head. And continue looking right here, right between my eyebrows. Tell me when you see my finger enter your field of vision. Good. 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 And keep looking right here. Tell me how many fingers I'm holding up. So then, yeah, it looks like you got a pretty good goose egg going on there. And you're not seeing any bleeding that you know of, okay. Okay. Any difficulty swallowing? Okay, so it's just your jaw. All right. Well, I can get you an ice pack, which should help you feel a bit better. go ahead and hold that right there, okay? Alright, let's go ahead and get these back. I'll take the clip first. So, looks like you're a bit shaky. Would you like me to help you with filling out paperwork? I can absolutely do that. So, just a second. You've been here before? Okay. And, okay. Can you just verify the spelling of your last name for me? And your first? Okay. And your date of birth? Okay. Are you still living on Southeast 8th? Okay. And phone number ending in 1974? Okay. And I'm showing your pharmacy on file being the Kroger on Main. Is that still accurate? Okay. And Aetna Meriton Insurance? Okay, good. So, oops. I'm gonna go ahead and move my keyboard over. Okay. And then with the mouse. Is it okay if we leave a voicemail, if need be, on your phone number? Okay. What is your marital status? Okay. Social security number? And your employer? Primary care physician? All right. Do we have this? Are you the primary subscriber on your insurance? Okay. So I will need you to do your best to sign right here at the bottom for me. Great. Date. Okay. Okay. So, in the last year, have you had any kind of dermatological symptoms such as eczema, rash, irregular moles, or discolored skin? Okay. How about with head, ears, nose, and throat, such as ear ringing, ear infection, sinus issues, or mouth sores? Okay, you had an ear infection. Do you know when? Okay. Cardiovascular, so any chest pain, heart problems, or fainting? Any respiratory issues, cough, wheezing, shortness of breath, sleep apnea, snoring? Snoring, okay. Gastrointestinal, such as stomach pain, nausea, vomiting, or constipation? Okay. How about any kidney, bladder infections, any pain with urination? Any easy bruising, easy bleeding, or swollen glands? With the ear infection you had, okay. Any musculoskeletal issues such as swollen joints, muscle spasms, or cramps? Any thyroid issues or diabetes? How about headaches, dizziness, tremors, poor balance, or any other neurological issues? Okay. Depression, anxiety? All right. So then we'll need to read to your HIPAA policy. So number 1 is we are concerned with protecting your privacy. While the law requires us to give you this disclosure, please understand that we have and always will respect your privacy of your health information. Your healthcare provider and members of the staff may need to use your name, address, phone number, and your clinical information to contact you with appointment reminders, information and treatment alternatives, or health-related information that may be of interest to you. And then you may restrict the individuals to which your healthcare information is released. Please complete the below chart as to whom you authorize to receive your health information. Your primary care. Okay. So then you can decide if it's all information, results only, or appointment status. And protected information may be disclosed via home voicemail, mobile voicemail, work voicemail, or email. Okay. And then what are you being seen for today? And how long have you had symptoms? Okay. And can you list your symptoms for me? Okay. This I think we can skip. Okay. Do you smoke? Have you ever smoked? Do you drink? Current medication, supplements, and vitamins. Is that over the counter? Okay. Surgical history. Okay. Do you know what year? Okay. Any allergies to medications, food, environment, or chemical? And what's the reaction? Cozy Hospital, this is Rachel. Just a moment. Chelsea, you have a call on line 3. Chelsea, line 3. Sorry about that. Okay. So now I'm going to go through a list of conditions, and I need you to tell me if you or anyone in your family has a history of these. So, acid reflux, alcoholism, aneurysm, anxiety, asthma, blood clots, cancer. Okay. Depression, emphysema or COPD, gout, headaches or migraines, heart attack, hepatitis, high blood pressure, high cholesterol, kidney disease, kidney stones, liver problems, lupus, obesity, osteoarthritis, osteoporosis, rheumatoid arthritis, seasonal allergies, yeah, don't we all, seizures, sleep apnea, STD, HIV, stroke, substance abuse, and thyroid problems. And then this I can get from your physician. I just need to know, do you know the date of your last tetanus shot? Okay. Okay, so then this is another page where I will need your signature here, okay? So this is basically saying that it is your responsibility to keep our office updated with correct insurance information. If the insurance company you designate is incorrect, you will be responsible for payment of the visit and to submit the charges to the correct plan for reimbursement. It is your responsibility to understand your benefit plan with regard to, for instance, if a written referral or authorization is required to see specialists or if prior authorization is required prior to a procedure. Some charges may or may not be covered. While the filing of insurance claims is a courtesy that we extend to our patients, not all plans cover all services performed in a chiropractic medical office. All charges not covered by your plan are your responsibility. And then the rest of this is basically saying that you are responsible for any and all co-payments, deductibles, and co-insurance. Financing is available with care credit for those who apply. If we do not participate in your insurance plan, payment in full is expected from you at the time of your visit, which we do. Self-pay, patients must pay at the time of service in full. General benefit verification will be provided on the second visit as a courtesy to patients. However, that doesn't really apply to the emergency room. Bills unpaid for more than 90 days will be turned over to a collection agency unless other arrangements have been made. There is a service charge of $20 for returned checks, which that's not really applicable these days because we don't take checks anymore, so we'll cross that out. And then please call or email if you have questions or trouble paying your bill. Refunds are only provided after all outstanding claims have been processed by the insurance company for services rendered and after patient liability has been accounted for. So then I just need you to sign here saying that I've explained this to you and that you understand. Perfect date. I just need to sign as witness. Okay, and I do have here our HIPAA release form. So if you would like us to release your health information to anyone other than a doctor involved in your care, I will need you to fill this out. Yes, we do need to fill it out even if you want to hold the medical information yourself. So just a second, let me just copy this in. So then this says, in accordance with the provisions of the Health Insurance Portability and Accountability Act, HIPAA, I, the undersigned, grant permission to Health Equity Incorporated and the Cozy Hospital to disclose protected health information to the following person or persons, and that's your name. Okay. Alright, so then I will need you to put today's date, your date of birth, write your name, and then sign. then that is everything I need from you. So you can go ahead and have a seat, and I'm gonna let them know that you are here, okay? Hi Megan, this is Rachel at the front desk. I have a patient here with a head injury who is ready to come back. Is there a room available? Great. Thank you. Cozy Hospital Emergency Department, this is Rachel. Yeah, can you hold for a moment? Great. Dr. Cozy, you have a call on line 2. Dr. Cozy, line 2. Cozy Hospital Emergency Department, this is Rachel. No, he won't be in until probably about 3 p.m. Can I take a message? Yeah, how do you spell that? Okay. 206 688 1297 extension 5. Okay, got it. I'll give them the message as soon as I see him. No problem. Thanks. Bye. Cozy Hospital, this is Rachel. Yes, sorry, emergency department. It's been a long day. I've been pulling a double. Yeah, she's here. Chelsea, you have a call on line 4. Chelsea, line 4.